Hi everyone, Dr. Hall here. We're going to do the carotid triangle today. So I've started off with my common carotid artery, and just so you know, this is going to be a left lateral view. So the nose is over here, anterior is over here, posterior occiput is over here. So here comes my common carotid, and then that's going to bifurcate, right, branch into two, into the internal carotid, which is going to be the more posterior of the two arteries. The internal carotid, of course, is then going to go up through a foramen in the skull to supply the brain. And then the external carotid. The external carotid, is going to travel more anteriorly, because then that's going to branch out and supply the face and the scalp. It's going to send a whole bunch of branches out to these more anterior and superficial structures. So common carotid, internal carotid, external carotid is anterior. Now I'm going to go ahead and add a landmark here, which is going to be the hyoid bone. So the hyoid bone, as you'll remember, is that kind of almost horseshoe-shaped bone. So we're just seeing the lateral portion of it here. I'll try to make it stick up a little bit. You remember that bone doesn't articulate with any other bone, just with muscles. So let's go ahead and add some of the nerves in here now. First, let's do our old friend, the vagus nerve that we know and love now. So the vagus nerve is also known as cranial nerve 10. Cranial nerves are nerves that come right out from the brain. They don't go through the spinal cord. I think of them as kind of like the VIP nerves. They're too good for the spinal cord. So vagus means wanderer. We're going to see this nerve not only in the thoracic cavity, as we've already learned, but also continuing down into the abdominal cavity. It's going to be the main purveyor of parasympathetic stimulus to our viscera. The other nerve that's coming down, also a cranial nerve, is the hypoglossal nerve. So hypo means underneath, glossus is tongue. So the hypoglossal nerve is going to be coming down and making almost a 90-degree turn here and traveling anteriorly, because up here is where the mouth is. We're very high in the neck, right? So here's the hyoid bone, which is right underneath your jaw. So, right, the mouth and everything is right here. So there's our hypoglossal nerve, which is going to obviously supply sensation to the tongue. And now I'm going to add in our internal jugular vein. So the internal jugular vein travels with the carotid and oftentimes kind of hides the vagus nerve from our view. So those three things run together. And then the last nerve I'm going to add is also a cranial nerve 11, the spinal accessory nerve. And that's also going to be coming down from the brain. I'm just going to move this over here to just show you a relationship. It often crosses anterior to that internal jugular. Now the spinal accessory nerve, interestingly, so the vagus nerve is super important, parasympathetic nervous innervation, hypoglossal nerve, important for our sense of taste. Spinal accessory nerve, interestingly, is mostly just a musculoskeletal nerve. So it's going to supply the sternocleidomastoid muscle. So it's going to actually course along the deep surface of the sternocleidomastoid muscle, and then continue posteriorly to then also innervate the trapezius muscle. So, there's one more muscle that I almost always forget, which is funny because it's my favorite muscle, which is the omohyoid muscle. You might remember it has a superior and an inferior belly. And I'm going to reflect back the sternocleidomastoid muscle to put it in place, because it's going to be deep to it. So you might remember it extends from the hyoid bone and then down to the, I don't think you can see, there we go, down to the clavicle. Okay, so down to the clavicle here. So my sternocleidomastoid muscle is going to be superficial to the inferior belly of my omohyoid. I have my sternal belly and my cleido or clavicular belly of the sternocleidomastoid muscle. So now let's review. Grab a pointer. Here we go. So going from superficial to deep, we have our sternocleidomastoid muscle with the sternal and clavicular heads. When we reflect that, we will see on its traveling along its undersurface, we will see the spinal accessory nerve. When we look anteriorly, we see, trying to get the camera a little bit better here, we see the omohyoid muscle. I'll reflect that out of the way. And now we can see these contents which are normally within the carotid sheath, which is a collection of connective tissue. We've got our internal jugular vein, our vagus nerve, our hypoglossal nerve, and then of course our internal carotid heading up into the brain, which is the most posterior of the two branches, the external carotid, which is the more anterior, both of them branching off the common carotid. And that's the carotid triangle.